Well, for me, I see a lot of geriatric population, a lot of elderly. So that's who I think about as kind of that perfect patient, because they oftentimes have a number of different comorbidities going on. And with cannabinoid medicine, that's, you know, one of the best parts for me is that it's multimodal. You can treat a number of different diagnoses with one medication. So in my head, that perfect patient might be someone with chronic pain and potentially, let's say it's neuropathic pain, and they also have a sleep disorder as a result. So you can use a cannabinoid therapy to treat the pain, and a side benefit of actually getting a better sleep. And oftentimes, these patients have concurrent mood disorders as well. So then we're thinking, okay, they also might have a bit of anxiety. And in that realm, again, if you can manage anxiety, sleep, and pain with one medication, to me, that's best practice. Lydia?
I see so many patients who are on multiple medications, especially a lot of sedating medication. You start them on a cannabis product and they'll come back and they'll say, I don't need as much opioid, or I don't need any opioid. I've stopped my benzos, I've stopped other sedating medication, and they're now getting benefit from this one product. So that, to me, when that happened for me the first time, it was really an aha moment. And you know, in my practice now, I've seen so many patients like that.
I would jump in too and say, on that note, patients have those results, and one thing I tell them when we start therapy now, because I've seen it a few times, is don't wean anything yourself. They're feeling so good, they want to come off these medications, and they'll often try and do it themselves. So I always, before we get started, say, you're going to have some success, but please, let's discuss the weaning of medications together.
One of the reasons why it's important to continue to treat cannabis medically.
Yes.
And not
Exactly.
get rid of the medical stream just because we have recreational cannabis available.
Yeah.
Exactly.
Yeah.
I find a lot of times the ideal patient, we're looking at their symptoms, not necessarily that, oh, do you have a diagnosis of a disc being bulging out, or do you have this or this condition. It's more, what symptoms are you coming in with?
Yeah.
And let's see how we can address those symptoms. Again, using a safe medication that a lot of times, like you said, they'll wean off themselves.
And it's like Lydia was saying, it's also symptom clusters.
Right.
And Blake, so if they have pain with anxiety, with difficulty sleeping, with appetite issues, with many other medications causing side effects, well, maybe we can try cannabis.
But that's, I think that's part of the reason why I think a lot of healthcare professionals have a difficult time accepting cannabinoid
Absolutely.
medicine, is because we're so focused on one disease, one pharmaceutical medication to treat that disease. Where in endocannabinoidology, you can use cannabis to treat multiple different conditions, where we don't have pharmaceutical drugs that are used to treat more than 10, one drug that treats 20 different medical concerns.